So what is pneumothorax and what is hemothorax? Pneumothorax happens when air leakage into the lung in the pleural space of the lung, air gets trapped in there, and that can cause the entire lung to collapse. Hemothorax, on the other hand, is when blood gets trapped in the cavity space and this pleural space of the lung, and that can also cause the lung to collapse. There are two types of hemothorax. First is the simple hemothorax, which happens when less than 1,000 milliliters of blood gets trapped in the chest. Massive hemothorax is when over 1,000 milliliters of blood gets trapped in this space. So what are some causes of these conditions? Starting with pneumothorax, the most common is trauma to the chest. A good example of this was in 2001. Former quarterback for the New England Patriots, Drew Bledsoe, took a hit to the chest against the Jets. This caused him to actually have pneumothorax and his lung completely collapsed. Other causes of this condition can include surgery to the lung and chest area, as well as certain lung diseases like cancer. Hemothorax, the causes are very similar. Again, massive trauma or injury to the chest, surgeries to the lung and chest area, and again, certain diseases can cause hemothorax. When you are discharging a patient with pneumothorax, you're going to want to teach them the warning signs that they might have this condition. This also can count as your assessment of the patient, and these are what you're going to be looking for when you are assessing them. So first, you're going to see rapid respiratory rate in these patients. You're going to see low oxygen levels, low blood pressure, rapid heart rate, chest pains, diminished lung sounds, asymmetry of the thorax. The trachea is going to be moved away from the midline and towards the unaffected side of the body. You're going to see you're not going to hear any breath sounds over the affected lung. And when you are doing your chest exam and you're percussing the patient's chest, you're going to hear a hypertympanic sound over the affected side. For lab values, these patients also show high levels of CO2 and oxygen in the blood. Hemothorax, these patients in your assessment, you're also going to see a rapid heart rate, low blood pressure. They're going to report chest pains, cold, clammy skin. They're going to appear restless and have anxiety. They're going to have respiratory distress when you are listening to their breath sounds because they're going to be reduced. When percussing that patient during your chest examination, you're going to hear a dull sound over the affected lung. And during a chest x-ray, you'd see blood in the pleural space of the lung. So what are some diagnoses you'd see for these patients? First, you could see ineffective breathing patterns related to chest wall deformity as evidenced by chest and lung collapse. Acute pain related to physical injury as evidenced by trauma to the chest. Risk for decreased cardiac tissue perfusion related to hypoxia as evidenced by low SaO2 levels. And risk for acute confusion related to delirium as evidenced by change in consciousness due to their low oxygen levels. When planning for these patients, the goals you want them to have, the patient will be able to breathe comfortably by the end of hospital stay. The patient will express an acceptable pain level on a 1 to 10 pain rating scale by the end of the hospital stay. The patient's SaO2 levels will return to normal by end of hospital stay. And the client will demonstrate restoration of cognitive status to the baseline by the end of hospital stay. So you want them to be back to where they were before they had that condition. So what are some interventions? How do you help your patients with these conditions? With pneumothorax and hemothorax, the main help is to give them insert a chest tube. This chest tube is going to be inserted in the fourth intercostal space. And for pneumothorax, you're going to see it attached on the other side to a water seal, and this will help reinflate the lung. For hemothorax, the chest tube is going to be more focused on removing blood and preventing infection. When your patients have these chest tubes in there, you want to be very careful to monitor their vital signs, the input and output levels, as well as their blood loss. And this condition can be very painful, so they're also going to be on pain medications as well. When evaluating these patients, you want your patients to report no respiratory distress when breathing, Patients report an acceptable pain level using a 1 to 10 numerical rating scale. The patient's SaO2 levels are returned to an expected range of 95 to 100%. And the patient's cognitive status will return to levels prior to admission to the hospital.